Hi there, this being the Mental Awareness Month, I would like to share with you about three mental conditions that are usually stigmatized or even misunderstood. And these are schizophrenia, depression, and learning difficulties in children. Today, I would like us to focus on schizophrenia. Schizophrenia is a mental disorder that is characterized by hallucinations. So the person might either have audio hallucinations, where they would talk about hearing sounds, hearing people that other people cannot hear. They can also be visual hallucinations, which could be seeing things or people that other people cannot hear. People with schizophrenia will also be delusional. That is, they'll have strong beliefs that have no sufficient evidence. For example, they would have a belief that somebody is after them, that somebody wants to kill them, or even a belief that we call a reference. Reference means natural things that will occur in natural circumstances, but to them, they will be having a deeper meaning. For example, when it rains, a person with schizophrenia would take that as a message to them that either something is good is going to happen, or someone is looking after them, or maybe even a spiritual being is trying to send a message to them. This disorder can also be characterized by behavioral characteristics, where somebody will neglect themselves, they will not have good hygiene, and generally they will not be aware of their surroundings or people around them. This condition is normally stigmatized and thought about as a spiritual condition. This condition is usually stigmatized and thought of as a spiritual condition. Maybe to understand that better, you need to look at the names that we give to schizophrenia, or even local names that we give them. In English, another name that is given to people who have got schizophrenia is lunatic, which has got something to do with the moon. And of course, the moon is also associated at times with spirituality. In our local languages, for example, Kiswahili, we talk about mwenda wazimu, and wazimu we know are spirits, or mizimu are spirits. So this is generally a person who has got spirits inside them. And therefore, it will be associated with witchcraft. It will be associated with people who have maybe been practicing things like devil worshipping and all that. And therefore, being associated with the spirits, the people with schizophrenia will either be taken to be evil in themselves, or even to possess some evil spirit. When this happens, the person with the schizophrenia is usually feared, people will run away from them, and people will not like to associate with them. The other thing is that people will also fear family members, close friends to them, and in some cases will even have people they suspect to have done spiritual rituals to them. And that would even lead to more stigma, not only to the person who is sick, but also to the whole family as well. Most often, people with schizophrenia will be neglected, they'll be alienated, and people will usually look at them as people who have no relative, nobody to care about them. And the relatives will be ashamed of them, will not like to be associated with them. And therefore they get worse with time, because schizophrenia is also a condition that can be progressive. What people should know is that though schizophrenia has no cure, but can be treated. And people with schizophrenia also can live their dreams, they can work in offices, they can have their professions, and therefore would lead a normal life with proper psychiatric treatment. However, schizophrenia can be managed with proper treatment from the psychiatrist, and family members together with the person with schizophrenia can also undergo therapy so that they understand the condition more and they learn how to live with it.